So really expensive because we're really churning in a lot of material resources into that care to try to keep that person alive. But the cost doesn't equal a different outcome. We're putting all that money in, and we're not staying alive longer, and we don't have a better quality of life. So in comparison between conventional patients and palliative care, I'll tell you a little bit more about what palliative care is, but a hospice is one example of palliative care. Folks who stay in conventional do not have a higher quality of life, even though they're getting a lot more inputs. And that's probably, from my observations, it's all the inputs that are decreasing your quality of life. You really can't enjoy anything anymore because there are so many tubes going into your body, you can't get up out of your bed. So we have these three models of end-of-life care in the United States. Conventional care, hospice, and palliative care. And this is kind of how they developed, just a brief history. Before the 1930s, we all died at home, pretty much. And then we had this pretty big social transition where people stopped living with their families and started moving for job purposes. Cities were getting bigger. People were moving away from the farm and going to work in the factories and all that sort of thing. And because of that, you didn't have your family there to take care of you anymore. So we started transitioning the dying into hospitals. And we also had a lot of those technological advancements from World War II. Chemotherapies are one example of things that we started having the ability to lengthen life through ventilators, things like that. So we really started shifting people to the hospital. In the late 60s, the first sociological studies were done on this, and they started questioning, well, are these people dying well?